Welcome to Diabetes Primetime, everyone. Tonight we are doing a very special show all about low blood sugar, what it is, what causes it, and what to do about it. And we have two incredible guests who are going to be sharing their wisdom with us. Susan Weiner, an amazing diabetes care and education specialist, and Anna Norton, the CEO of Diabetes Sisters and a person with type 1 diabetes. Ladies, thank you both so much for joining us tonight.
Thanks so much, Ansley. Great to be here.
Yes, thank you so much, Ansley. I'm so happy to be here with you and Susan tonight.
So folks, before we get started, tell us in the comments whether low blood sugar is something that concerns you. I'm hoping that the information Susan and Anna will be sharing tonight will make you feel empowered and put your mind at ease. Anyone who leaves a comment for us during this show is going to get a collection of recipes that our diabetes dietitian Melinda has put together for us. These are easy recipes that use some of the healthiest foods out there. And as an extra special bonus tonight, we're going to be doing a drawing from all of the commenters on tonight's show, and the lucky winner will get our guest Susan's wonderful book, Diabetes 365 Tips for Living Well. So you don't have to answer a trivia question tonight. All you have to do is leave a comment to get those recipes and be entered to win that awesome book. So be sure to say hello to us in the comments. Susan, I'd like to have you start us off. Tell us, what is hypoglycemia, kind of the technical term for low blood sugar, and what are the most common symptoms?
Hypoglycemia, or low blood sugar, is when your blood sugar goes below 70 milligrams per deciliter. And it's really important to take action quickly in order to bring it up into target range. When your blood sugar level drops, that may trigger the release of a stress hormone called adrenaline or epinephrine, or the fight or flight hormone. When this happens, you may feel anxious, sweaty, all those rapid heartbeat type of feelings that go along with hypoglycemia. You may also become somewhat confused. There's some cognitive impairment, and therefore your judgment may not be as keen as it is typically. So please make sure to speak to your doctor or your healthcare professional to find out what blood sugar range is right for you. It's really important.
I'm so glad you mentioned that, because it really is important to kind of get those targets, that sense from our doctor about our unique health situation. You know, what's that number where I should start being concerned? Anna, you're a person living with type 1 diabetes. What have you learned about hypoglycemia and the most common things that can cause it for you?
Well, I learned about hypoglycemia 27 years ago, right after my diagnosis. My physician at the time explained to me that inevitably, because I was on insulin, I would experience hypoglycemia. His advice to me at the time was, keep a soda in your dorm room refrigerator, not a diet soda, a regular soda. And I did that. And then he taught me how to look for the symptoms of hypoglycemia. If I was shaky, or if I was a little bit confused or sweaty. Since then, I really have learned a lot more about hypoglycemia and the way that my body reacts to a low blood sugar. It's really a learning curve for me over time, because things have changed as my diabetes journey has moved forward.
Susan, what medications can put someone at risk for low blood sugar? Who should be thinking about this and be aware that it might be a possibility?
That's a great question, because hypoglycemia can happen to anyone who is taking insulin, even if you're taking insulin once a day. And all people with type 1 diabetes require insulin, and many people with type 2 diabetes require insulin as well. There are also certain medications that people take that cause the production of extra insulin, and those medications can also cause hypoglycemia, primarily in people with type 2 diabetes. There's a fear for people around hypoglycemia and medications. So this needs to be brought up in educational sessions with your certified diabetes care and education specialist, with your physicians, with your healthcare team. It affects people who have diabetes as well as those who love them. So it's really a conversation that we need to have if you're taking these medications.
So you mentioned insulin, of course, and you mentioned other types of oral medications. Is there a distinction between people with type 1 and people with type 2 when it comes to hypoglycemia? If we're both on insulin, is there a difference that we might experience?
People with type 1 and people with type 2 diabetes who are taking insulin can both have hypoglycemic reactions. So they have to be treated the same if they have low blood sugar.
Got it. Okay. Anna, Diabetes Sisters does a ton of fantastic minority outreach initiatives, and your family is originally from Cuba. So tell us, is there anything additional that African American or Latino people with diabetes should know about low blood sugar?
Absolutely. And that's a wonderful question and a great point to bring up. I think traditionally speaking and generally speaking, when we're talking with minority groups and underserved populations, we don't have a lot of conversations about health around the table. And that's really unfortunate because what we are lacking sometimes is education. I know that in my experience living in a Cuban household when I was much younger, talking about hypoglycemia was really, really important because that my parents needed to understand how to help me if I was low. And so that is something that I have really, really worked on over the years, both in my personal life and in life at Diabetes Sisters, to really get those messages across, to educate people on what hypoglycemia is, the treatments that are available, things that you should do to help prevent hypoglycemia, and how to communicate about it with your loved ones, with your coworkers, with people that are surround you.
Oh, that's great. Folks, I'd like to pause for a moment here and say that we thank Lily for their support of this program. However, Lily had no influence and did not augment the information presented through this program. Okay, this is a question for both of you, and it's the part that really matters. What should someone do if they're having a low? Susan, start us off.
So treating hypoglycemia has to be individualized. It is not a one-size-fits-all, but a great place to start if you're experiencing mild to moderate hypoglycemia is what we call the 15-15 rule. You can start by taking 15 grams of glucose or fast-acting carbohydrates, such as 3 to 4 glucose tablets or a glucose gel, and wait about 15 minutes, recheck your blood sugar, and if it's 70 milligrams per deciliter or above, you're doing great. Keep an eye on it. If it's lower, repeat. Take another 15 grams of carbohydrate and look at it again. If you have a severe low blood sugar, then that will require assistance and administration of prescription glucagon, most likely. So speak to your physician or your healthcare professional about which glucagon treatment might be right for you, and speak to your family, friends, loved ones, even coworkers about what that means. They also should not hesitate to call 911 or to get assistance if they understand that you're having a low blood sugar. So communicate all of those thoughts with people who that you may be spending time with.
Anna, I know there are some new forms of glucagon available. So tell, for the folks watching at home, tell us what glucagon is, because it may be something that people aren't familiar with, and talk about the new formulations of it that are making it a little easier to take.
So glucagon is certainly emergency therapy. It's not always the responsibility of the person with diabetes to carry it. So sometimes when you have severe low blood sugar, you can't help yourself. Over the last several years, my husband has always carried a glucagon kit when we travel or in his night table drawer, things like that. Because if I'm having a severe low blood sugar, then I can't help myself. I can't do the 15-15 rule. I can't have some tablets or some Skittles or have a juice or something like that. So that has always been the responsibility that I have asked him to take, something that he has taken on over the years. But now there are so many great treatments that are easier to use than something like that. There are pre-filled pens. There's the new the inhaled glucagon, which is so much easier to use. And you can just, keep it on your night table. You could keep it in your pocket. For women, put it in your purse and just pull it out and really utilize that faster than trying to mix something in an emergency situation. And so it really has alleviated some of that fear that we were talking about when it comes to having a severe low blood sugar.
Susan, talk about why it's so important for every person with diabetes who's on insulin or a medication that might cause, low blood sugar, to always have treatment with them. I think sometimes it's easy to think, I'm just running to the store, I'm just going to be in the car for a minute. Talk about why we should always be prepared.
One thing about diabetes is that it's so unpredictable. That's the most predictable thing about diabetes, is that it's so unpredictable. Being prepared and having things with you at all times, and glucose tablets or glucose gels, or having a tablespoon of honey or sugar with you in a bag, if that's helpful for you, is non-perishable and can be kept with you in case you do have a low blood sugar. It is much more challenging to treat something if you're not prepared. And diabetes is so overwhelming. There is so much information around it that taking some of those steps, which may be simple, can really help you feel secure if you do go out, if you have unexpected increased physical activity, because nobody plans for the low blood sugar. have things with you so that you can prevent that low whenever possible.
Oh, great answer. Folks, for everyone watching at home, just a quick reminder to leave a comment for us. Tell us how you're doing tonight and where you're watching from. If you leave a comment for us tonight, you will get an amazing PDF with easy, delicious, diabetes-friendly recipes for some super healthy foods. And as a bonus tonight, one lucky person who leaves a comment for us will get a copy of Susan's fantastic book, Diabetes 365 Tips for Living Well. All you have to do is leave a comment and you will get those recipes and be entered to win the drawing. Anna, talk about why, in your experience, it's so important to be prepared for lows, and give us some examples of how you make that easier for yourself.
I've always tried to be prepared because diabetes prepares us for the unexpected. It really, really does. So I always carry snacks. I think it's part of even my upbringing, not just diabetes related, but I remember my mother always used to have a snack if we were out somewhere and I'd say like, I'm kind of hungry, And so I continue to do that. I just carry lots of different things in my bag, in my travel bag, in my work bag. I like to keep things in my desk drawer, in the car console. When I go to work out, I like to have something because I never know what's going to happen. One of the things that I learned really early on in my diabetes journey was that sometimes a low and a high could really be similar in symptoms. And I remember my physician telling me, if you think you're low, eat. If you're not sure and you don't have your meter to check, eat. Eat something, put something in your mouth and start to digest that. We can take care of the high in a little while. If for some reason I'm unprepared without a meter or I'm not wearing my CGM and I just feel a little bit off, then I will eat. Because sometimes, with hypoglycemia unawareness, I don't know what my blood sugar might be.
I think that's really, really great advice. Just kind of err on the safe side and, prevent what might be a low from going even lower. I think that's excellent. Susan, Anna alluded to this earlier, but what should a person with diabetes make sure their family knows about low blood sugar and what to do if they go low? Because I think for so many of us, it's something we don't know anything about. A loved one or a family member starts on insulin and we just feel overwhelmed. So would you advise that they come to an appointment? How should that person make sure their family's educated?
And at the beginning, when someone is diagnosed, as Anna was saying, they are overwhelmed with information because there's so much that we want to share that we're hearing from a physician, from a diabetes care and education specialist, from a healthcare team. All this information is pouring out at once. And a lot of times at the beginning, hypoglycemia is not even mentioned. Even for a person who is on insulin, type 1 or type 2 diabetes, even for a person who is on a medication that may cause hypoglycemia at certain times. That is entirely possible. But the first thing is to share the signs and symptoms and then describe to them the 15-15 rule and how they can help you with checking your blood sugar and embracing the technology, such as your continuous glucose monitor, and how it works and what it means, and showing it to them and what it means if the arrows are pointing down and how they can help you. And if it's a severe hypoglycemic reaction, if you are having emotional outbursts like excessive laughter or excessive irritability, that might mean that your blood sugar is going very low and what to do about it. And if glucagon does need to be administered and if 911 needs to be called without hesitation. So invite them into your world as you're comfortable with it. They will embrace it with you.
Oh, great advice. And is there anything that you've noticed that's made your conversations with family members easier? When you're speaking with your Diabetes Sisters folks, is there any advice you give about how to start that conversation with a family member and perhaps make it go a little more smoothly?
Yeah, I love that you asked that question because it is something that we talk about when we're living with diabetes. And at Diabetes Sisters, we do some information and we talk a lot about communication, how to communicate about diabetes. And the first thing that we offer when it comes to advice is don't wait to communicate about how you want to be treated while you're low. Wait until you're not low anymore. And I think sometimes we don't realize that we haven't had the conversation. We're low. Our partners or our family members or our coworkers don't know what to do, and we're trying to explain what to do, and we can't because our brains are working so much slower. So first and foremost, the conversation should be had before anything even happens, and that's just a simple conversation with a coworker or a friend. Hey, I have diabetes. sometimes I might, if you ever notice that I'm acting a little bit strange, or I'm laughing too much, or I'm irritable, or I get really tired, or I'm shaking or sweaty, any of the symptoms that we encounter with hypoglycemia, just give me a couple of lifesavers. I keep some in my bag. I keep some in my desk drawer. I have some in the car, whatever the case may be. And then, if you continue to notice that I'm still acting a little bit odd, nudge me and ask me to check my blood sugar. Or if I'm unconscious, if it's a real emergency, please call 911. I think that having that conversation before anything happens is really integral in our mental health, and in the mental health of those that really care about us.
I think that's a great point, because it's like we know we have a plan. We know we've had the conversation. The framework is there if something were to happen. Susan, let's take a step back and make it really clear why this is so important. What can happen if someone is experiencing frequent low blood sugar episodes over time?
If blood sugar levels continue to drop and low blood sugar episodes become frequent, the brain doesn't get enough glucose and it stops functioning as it should. This can lead to more severe symptoms of blurry vision, difficulty concentrating, confused thinking, slurred speech, numbness, drowsiness. And if the sugar stays low for too long, which starves the brain of glucose, it can lead to permanent neurological damage, seizures, coma, and in some terrible cases, even death. So the conversation around hypoglycemia is a real one, and it needs to happen with friends, with family, with coworkers, but also with clinicians. Why is this happening? Take that step back. Am I changing my diet? Am I skipping meals? Am I eating less at night because my work hours changed? Am I exercising more? Have I started to drink more alcohol, which can cause the liver to really try to get the alcohol out of your blood so it stops producing glucose? These are all conversations that are extremely important and need to be had in an open and honest manner.
And I'm really glad you talked about kind of figuring out what's causing lows. We talk about being a diabetes detective, but really kind of digging into like, wow, what's changed? What's happening in my life that might be causing my blood sugar to be different than it normally is? Susan, talk a little bit about what hypoglycemia unawareness is, and if someone has this, what they should do.
Hypoglycemia unawareness can happen to a person who has had diabetes for a while and may have experienced hypoglycemia for a long time. And after a while, they may no longer produce epinephrine. It may not react the same way, the stress hormones. So you don't feel those initial symptoms of a rapid heartbeat, of anxiety, of sweating the way that you used to. And if you ask a person who is experiencing hypoglycemia's unawareness how they're feeling, they say, okay, they don't feel bad until their numbers go so low that they become irrational in thought and they absolutely are very confused and cannot function. The best way to address hypoglycemia awareness and to treat it using a team approach is to embrace technology such as continuous glucose monitoring or CGMs, because when you embrace that technology and you see your blood sugar dropping, you see it dropping, you may not feel it dropping, but you see it dropping on your CGM, you can then treat it by eating something or taking glucose. You're aware of it. You can stop what you're doing. You may need to stop exercising or whatever you're doing and to treat it. Without doing that, you are unaware of the symptoms and some of those very negative aspects could occur. This treatment does not happen alone. As a person with diabetes, talk to your doctor about it, your healthcare team, your diabetes care and education specialists, and the people who love you. They want to help you with this as well.
So Anna, talk a little bit about how you utilize technology to prevent hypoglycemia or to recognize it as quickly as possible.
For the last 10 years, I have been wearing a continuous glucose monitor, which was brought on by a very, very extreme hypoglycemic event that I had. And it really, really caused me to stop and think and say, what's happening in my journey with diabetes? What can I do? How can I avoid this ever happening to me? And the motivation was that I had a son. My son was 2 years old. And I had an event at a mall with my son. And so the EMT had to be called. And so I did reach out to my endocrinologist, I think the day after, and I said, this cannot ever happen to me again. And so immediately I went on a CGM. I trialed it. I worried a lot about the cost about what it might cost to have this kind of technology. And I remember wearing it and having the first alarm go off during my trial. And my husband said, "What is that?" And we started to talk about it a little bit. And his reaction to it was so wonderful. He said, "It doesn't matter how much it costs. We'll find a way to pay for it because this gives everyone in our family peace of mind." And I remember 6 months in, even my son could identify the beeps and the noises and the alarms, right? And so over the last 10 years, it really has become just mainstream in our home. And sometimes those alarms go off and somebody in the house will say, "You're high," or someone in the house will say, "Hey, you're low." And it really is beneficial, not just to me as the person with diabetes, but the people that live in my house and the people that know me and the people that work with me.
Wow. That's really inspiring. Ladies, before we go, any last thoughts? Anything you want to make sure the folks watching at home know about hypoglycemia?
For me, yes, I do have something that I didn't know and I've learned over the years. And that's when it comes to hypoglycemia and exercise, especially when it comes to interval training. I have learned over the years that it's really important for me to carry any kind of emergency treatment when I work out. But then also when I do interval training, to think about what's going to happen 6 hours after or 8 hours after. And I've been able to learn how to adjust my basal rates through my insulin pump to give me less insulin on days that I do that, so that I don't go low in the middle of the night if I have exercise in the late afternoon or early evening.
So, Anna, it sounds like you've really utilized technology to kind of understand what exercise can do to your blood sugar and prevent those lows from happening. And that probably has just been a process of trial and error, right?
Oh gosh, yes, absolutely. I don't know. I didn't know a fraction of what I know now, 27 years ago when I was diagnosed. This whole journey with diabetes is it's an educational disease. I see it that way. I hope that other people that live with diabetes see it that way as well. It's an educational disease. It's not one size fits all. It's a lot of trial and error. It's a lot of getting back up when you fall down.
Oh, yes. Wise words. Susan, any last words of wisdom for our audience?
Speaking to your family, your friends, your coworkers, and your healthcare team is something that you should feel very confident about, because you are the person with the lived experience. And as a clinician, I really try my best to keep the language that I'm using non-judgmental and learning to be more of a listener. Before I provide a ton of information, I learn and listen and assess what the person is going through so I can be empathetic, because you're right, Anna, one size does not fit all when it comes to managing diabetes or treating hypoglycemia.
Ladies, thank you both so much for joining us tonight. It was such a great discussion, and I'm sure everyone watching at home learned a ton. I know I did, so thank you.
Well, thank you so much for having us.
Thank you, Ansley.
Folks, we will be back with you for our next show on Tuesday, October 20th at 8:30 p.m. Eastern Time. We'll be talking with pharmacist and diabetes care and education specialist Mandy Reese, who will be answering your questions about supplements, medications, and more. Be sure to tune in then. Until then, good night, everybody.